Hi everyone, Dr. Remy from Pain Free and Fit. If you have degenerative disc disease in your lower back, welcome to the club. Myself, many of my patients over the last 30 years have all tried the glute bridge exercise to help with their back pain. Unfortunately, there are many mistakes that happen in the glute bridge exercise that can actually make your pain and your problems worse. So this video is designed to teach you what those mistakes are, how to avoid them, and how to get the most pain relief and injury protection from your glute bridges. Enjoy. So the typical glute bridge is performed lying face up and squeezing the buttocks to raise the hips. We have a lot of people doing this for their degenerative discs in their lower back. Unfortunately, although this appears to be a safe exercise, it many times perpetuates mechanical dysfunctions that lead to more lower back stress and problems with those degenerative discs with pain. When the knees are bent doing this exercise, we have a tendency to overutilize the hamstring muscles versus the glutes. Because the knee is in a bent angle, it shortens the hamstrings and puts them into a more natural position that they're in during the day when we sit a lot. A lot of people with degenerative disc problems have their pains because of prolonged sitting, because sitting posture increases disc pressure versus standing by 12 to 13 times the body weight. So we're used to having the knees bent, and the hamstrings in that position are in a mechanical advantage. Their length-tension relationship has changed. So when we use this exercise to try to strengthen the glutes, which in many cases of lower back problems, including degenerative discs, are weak, we actually take away from the glutes, use too much hamstring, and perpetuate that muscle imbalance between hamstrings and glutes. And when the glutes are weak, besides the hamstrings overworking, that means the lower back muscles, the erector spinae, will also be working. So that's only going to put more pressure on the discs and take away from the intent, which is to strengthen the glutes. So the first correction that we do is we make sure that we use a elevated straight-legged glute bridge, so that as we're doing this, the knees are locked straight, and this allows the hamstrings to be stretched, making it more easy for us to contract the glutes if we use posterior pelvic tilt tension. This is the second mistake people make. As you come up, you need to keep a little tailbone under tension so to engage the abdominal muscles and release those lower back erector spinae muscles. Now, you can go back and forth from tilting your tail up to tucking your tail under to feel what your neutral position of your spine is and what's most comfortable. If you go too much tail up and increase the arch of your back, you're going to notice a little lower back discomfort. And if you tilt your tail under too far, you may feel the lower back discomfort. So you want to be at the mid-range between those two extremes and then maintain that throughout the motion of the glute bridge. By maintaining it, especially with tail under tension, be aware that as you get higher and higher, that tailbone is going to want to tilt upwards or increase the arch of your back. So you need more abdominal tension progressively as you go higher and higher in the range of motion. Another typical mistake, which I like, keeping the legs straight, that we correct, is the external hip rotation. Most people with degenerative disc problems have a problem with one hip rotating outwards. They stand and walk with one leg moving outwards more than another. This perpetuates hip hiking, or a shifting of the whole pelvis up into the rib cage on that side. And this exercise can be used to help correct that. It makes it more challenging when the legs are straight versus when they're bent to keep that thigh from externally rotating. When the legs are straight, the thigh naturally wants to go outwards. So it takes a little bit more coordination to keep that leg straight and not turn it out to the side as we do our glute bridge. As we're coming up, we also have a tendency to flex the spine. Now, one of the reasons that I like the glute bridge for people with really hot lower back problems, when things are really irritated, versus the squat, is that with a squat, there's still axial compression, meaning that there's going to be more head to toe compression on the discs. In this exercise, because we're pushing in a front to back motion, or posterior to anterior, all the stress on the disc is coming as a shearing force from front to back. There's very little compression from head to toe. So we want to make sure that we augment that by keeping that tail under tension and avoiding any hip hiking or rotation. Now, as I said before, as the leg moves out to the side, that side naturally has a tendency to come up. When we're on two legs, we may feel a little tendency for that hip to shift up. We have to hold that down. But we also want to make sure that we don't go into a typical rotation pattern with the pelvis. Most people with a leg that turns out to one side have a tendency to rotate their hips or their pubic bone to the opposite side. And that creates a torque on the spine. When my back is flat, my upper spine is being held stable and my pelvis has the ability to torque. Now the lower back was not designed for a lot of twist or torque. We want to make sure that the pubic bone and the belly button stay in alignment. If I do that on one leg, it becomes even more challenging. If I keep one leg up where my foot is not touching and perform the same straight-legged glute bridge, now I have a tendency to rotate a lot more. So if we're going to do one-legged bridges, this can be a plus or a minus. If we're not holding correct alignment, that could actually create a torque in our disc and hurt ourselves. If we are keeping good alignment with the belly button and the pubic bone being straight and avoiding hip hiking on that side, then we're not going to compress that side of the disc or create a torsion. So what I would advise you to do is make sure your form on a two-legged glute bridge is very good at first. You can even add some weight by holding some dumbbells at the hips or a medicine ball, making sure you have very good form in that exercise before switching over to one leg. If you do have a tendency to rotate one leg outwards or have a tendency to have the pelvis or the torso twist, that's an alignment issue that can also damage discs. If you're not sure about your unique posture or body mechanics, you can go to the Pain Free and Fit website. We have a free body analysis there where you can analyze your alignment that may be causing more irritation to your disc. Finally, when we do these glute bridges, it's important to work on isometrics as well as repetitions. The back muscles and the glute muscles with degenerative discs need two types of training. They need strength training to be able to lift things, and they need endurance training to be able to stay in positions for longer lengths of time using the correct musculature. So getting used to isometric holds at the top before you come down, varying from 5 up to 30 seconds, will really make this exercise very difficult but also beneficial for you. If you're emphasizing on all your corrections, avoiding any rotation, any hip hiking, any loss of the tail up or tail down from that neutral position that you set at the bottom, and making sure that you're emphasizing glute tension versus hamstring tension, meaning you're going to use your quads to keep the knees straight so the hamstrings relax, and tail under tension to release the back muscles so the glutes can contract, you'll really be strengthening the isometric contractions and endurance times of those glute muscles, which you need with lesser contractions of the hamstrings and the lower back muscles. So keep these tips in mind while doing your glute bridges. You'll stay out of a lot of aggravations and get the most out of your exercise to prevent irritations of your degenerative discs. If you've enjoyed this video on glute bridges and degenerative disc disease, please feel free to subscribe to our channel. We have a lot more videos on degenerative discs, exercises that can both harm you to stay away from, and good modifications and healing exercises to help get over your pain. If you'd like to help me share this with other people with degenerative disc disease, give me a thumbs up below. If you have questions or comments, please leave them. I'll do my best to get back to you. Remember that this glute bridge exercise and these modifications and other great exercises are right out of our new fast track program for healing degenerative discs in the lower back. It's a great way to get simple exercises in multiple times a day for just a minute at a time to really make a big improvement in your pain in minimal time. If you're interested in that program, and I highly recommend it, it's at our website, painfreeandfit.com. Enjoy.